Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph, and we begin and concentrate on St. Lucia's preparedness for the deadly Ebola virus. A high-level mission comprising officials and medical practitioners from the Pan-American Health Organization Paho and the Caribbean Public Health Agency Carpha Friday completed a two-day visit to the island. The team's mandate was to carry out a thorough assessment of the island's preparedness against Ebola. Dr. Malene Frederick is the Chief Medical Officer.
Can move on to component 5B,
and they are here to assist us with our preparedness for Ebola, as well as to assess us and enable us to identify any gaps that we have and assist us in filling those gaps to ensure that our preparedness is on par for any eventuality should in case we have a case of Ebola. So here today we have the team leader who's a specialist in disaster management. We have a specialist in the area of laboratory systems. We have a specialist in surveillance and epidemiology.
The head of the mission, Lealu Rebala, says the aim was to gather a sense of their current capacity and spot the deficiencies that would need correcting. The team visited all major health facilities and ports of entry.
We've just done our coordination meeting with the Ministry of Health. We'll be now moving to Victoria Hospital. We'll be looking at the isolation facility there. Then we'll have different meetings with different stakeholders. And tomorrow we'll be visiting the airports and Seaport. Then also visit St. Jude. And I think what is one of the important things that the team will be doing, and we'll be doing some training on the use of the personal protective equipment and hopefully assist the healthcare workers on case management and clinical management.
A member of the Paho Carpha mission is drawing considerable attention given the intimate information she has to share about the clinical and personal aspects of Ebola. Dr. Marta Asuga was a member of the medical team that successfully treated the world's first Ebola case outside of West Africa, Spanish nurse Teresa Rodriguez. She contracted the disease in West Africa while treating patients. The Spanish nurse has recovered, but a determination on how she contracted the disease is yet to be made. Nurse Rodriguez, like other members of the mission in West Africa, wore personal protective equipment, and she's the only one of the team who became infected.
We don't know if PPEs didn't work or what had happened to her, but when we realized that, yes, she got the illness and not the rest of the team, we just know that PPEs works and that we can work safely and without any problem. It was difficult to treat this kind of patients because although you can treat as other patients you have to dress like if you were an astronaut or something like that. It's very uncomfortable to work with this kind of suit because it's very hot and very wet there. So, and you have to move slower than you used to do. So, well, you have to train, and that's it.
Dr. Asuga says it is important that medical officials and other frontline workers not panic, rather pay attention to sanitization methods and limit direct contact with bodily fluids of a suspected patient. Also, know the facts about Ebola.
We have to do our work, okay? It's part of our work. Like we treat HIV patients or patients with hepatitis. We are working with his fluids or their fluids, okay? And we are in a risk sometimes, yeah, because if you have to take a drip to someone, you can't stick with a needle or something. So this is the same, but you have to have caution and to be sure that you are doing the best you can. And after for the population, please don't stigmatize the health workers that are going to be in contact with these kind of patients, okay? Because asymptomatic person can't transmit the illness.
Early diagnosis, the Spanish doctor says, saves lives. The crisis in West Africa, she says, is attributable to the virtually non-existent healthcare system. And the Paho Carpha team led training sessions in the donning and doffing of the personal protective equipment, the PPE. Firemen, police officers from various departments and corrections officers were taught the correct method of placement and removal of the equipment. Dr. Alicia Eugene is the disaster coordinator within the Ministry of Health.
Firemen and police officers, they play a very vital role to assist when we have an Ebola case or a suspect Ebola case, and it is very important that they know, like healthcare officials, how to put on the personal protective equipment and how to remove it. Because if it's not done properly, then they run the risk of being infected. So it's very important that they know what is Ebola, how it is transmitted, the symptoms and signs, but also how to wear the suit properly, how to remove it. It's very important.
Officers of the fire service welcomed the direct training.
Well, being the front line, most if not all of us at the fire department are very nervous. Some of us are scared to be involved in this, but of course that's part of our job, dealing with persons who are sick or injured, and especially with this epidemic worldwide. It's just our sole responsibility to provide care. We have many different types of PPEs. For this biological virus, we have the specific one at this time, and I feel comfortable in it, especially with the upgrade that the Center for Disease Control and Prevention has indicated in terms of upgrading the level of protection.
Fernando James was a member of the St. Lucia delegation that recently underwent training in Cuba on all aspects of Ebola. He believes St. Lucia is well on its way to being prepared for any eventuality.
And we covered many very important areas which overlook the Ebola virus in terms of epidemiology and the clinical operations and how to set up a field disaster hospital and a quarantine units, and also we also did the donning and doffing of the PPE. So in terms of our preparedness, it's information that we are known, but with added information and training, it was very helpful being across there and seeing how the Cubans are setting up their own preparation for any suspected cases. Fire department, it's prepared, I wouldn't say 100%, because one of the things that you may find is that a number of persons are still a bit frightened and have not volunteered to be part of the response teams. But in terms of preparations, such as our responsibility will be to transport by ambulance, and we have already set up an ambulance, designated an ambulance out of our fleet, set up the patient compartment in terms of removing all the equipment, setting up with plastic and isolating it properly, so in the event that we have to transport a patient, it is properly ready. So it's there sitting and waiting in the event that the case comes.
And the Immigration Department is also confident that the national response mechanism has been shaped. Inspector Lucius Lake is in charge of the department.
I'm satisfied that the immigration officers, or as a whole, all the agencies involved know their part better now than before. We have some equipment on island. The Immigration Department will be going through its advanced passenger information, sharing that with Port Health and other agencies where it pertains to persons from the affected areas coming through. We also have a visa regime, and you have heard from Pelus and other persons within the department that we are more strict and going over all areas of the persons who require visas before entry into St. Lucia, which is going to help us reduce or understand better the travel history of the person coming into St. Lucia at all.
And one final note on the Paho Carpha mission. The team visited the private Tapia Hospital for a session with the administration and staff. Consultant physician and hospital director Dr. Martin Didier says there continues to be an abundance of caution in the medical fraternity because of the high mortality rate among those treating Ebola patients in West Africa. St. Lucia and the Caribbean, he says, was not prepared for any eventuality. However, considerable strides have been made.
In the patients during 82 days?
In the past couple of weeks, I have had the privilege of traveling to Dominica, Barbados, and Jamaica. And I can tell you that the same concerns that we had in St. Lucia were shared by all healthcare workers, including the public at large, throughout all these countries that I visited. So there was no one who could say that they were prepared. But as I said before, it's a journey. a journey that starts in education about the disease itself and continues with training of all healthcare workers.
Dr. Didier also cleared the air on reports that Tapia Hospital removed itself from the preparation process, informing that it would not treat Ebola patients if the situation were to arise.
There was no hospital, and I can say that when you look back at what had happened in the United States, where they said that most general hospitals within the United States, 3 to 4 times bigger than Victoria, Tapia, St. Jude's Hospital, would be ill-equipped to manage an Ebola patient. And that was something that was said by the American College of Physicians in a bulletin that they issued in the month of October. And so Tapia Hospital, because the motto was that where the patient comes first and patient safety comes first, we from earlier clock said that there was no way we could find out when a patient came in whether the patient had Ebola or not, because Ebola is a non-specific illness, and the differential diagnosis that one has if you see a patient who comes in with nausea, diarrhea, fever is very, very wide and includes many, many, many different types.
Being a small hospital with just 23 beds and no isolation ward, Dr. Didier says makes it impossible and dangerous to treat Ebola patients. Like Victoria Hospital and St. Jude's, who also do not have isolation wards, Tapia, he says, has an Ebola plan in place.
The Ebola crisis is actually one of the worst that we have faced in the history of medicine in this century. And I think it's a question of all hands on board, so we put all our resources together. I dare say that when St. Lucia first took the decision to stop people from these countries to come to St. Lucia, I would say this: I support the Prime Minister. I think it was a bold move on his part to say that if persons come from outside and we're not sure, our duty is to really protect our citizens and to protect our borders. And although I think that no one in their right mind thought that that was going to cure Ebola by protecting your borders, but at least it would give you an opportunity to prepare yourself should in case a case arrives at your doorstep, and that because you would need time to put measures in place so you could deal with the situation, so you take the responsibility to protect your nation.
The World Health Organization has said the Ebola crisis in West Africa is beginning to be manageable. However, much more resources are needed. Stay with the CTV News. We're back after the break.